Lung cancer is the #1 killer of both men and women. Here with some exciting news about the treatment options is Dr. Sudish Murthy, head of thoracic surgery at Cleveland Clinic. How are you, doctor?
Good, thanks.
All right, this is when someone hears that word, that term, it's pretty scary.
It is a scary term, and it turns out that deaths from lung cancer outpace the combined deaths from colon, breast, and prostate. So that's why we're here.
Now, a lot of people like me probably think I don't smoke, so I'm in the clear. I don't have anything to worry about.
Well, that's true. Let me just segue and say happy Great American Smokeout Day to you.
Okay.
It is the day where we encourage any smoker to hopefully, at least for 1 minute, 1 hour, maybe hopefully the whole day, put down their tobacco. But there is a concerning trend with lung cancer popping up in the never smokers.
Okay.
And we see that in our practice at the clinic.
Is that because they were around smokers, or is something entirely different that's causing this?
Well, part of it is secondhand smoke. So if you look at husbands or wives of smokers,
Okay.
they often have a slightly higher incidence, but some of it gets to things we don't understand, perhaps environmental causes, radon gas, pollution. It is still a small percent of all lung cancer patients that are never smokers, but it is something that concerns us greatly.
Now, I know it's advantageous. The earlier you catch it, the more opportunity is for some type of successful treatment. So what would be going on with my body that I would say I need to go and see a doctor?
Well, there are clear risks for lung cancer, and above all else, tobacco use and long-term tobacco use has been identified as a risk for lung cancer. And to that end, smokers or former smokers who have smoked perhaps 25 years in their life for maybe 1 pack a day and who are over age 50 are eligible to be screened for lung cancer with a standard chest CT scan, which can detect early lung cancer and has been proven to improve survival rates in those groups of patients.
Now, I would assume that most of the time, if you have this unfortunate diagnosis, surgery is going to be the main way that you would be treated. And I understand there's a new type of surgery that's not as invasive.
Well, of course, I'm a surgeon, so a chance to cut is a chance to cure for us.
Okay.
But the latest innovations in operative interventions for surgery are that often less is more. So we're trying to do bigger operations through lesser incisions, and I think overall the patients benefit. They feel better more quickly. They recover and get back to gainful employment or get back in their routine swing of things much more quickly than what we used to offer historically.
And what's that type of operation called?
Well, they fall under a category of minimally invasive operations. We have video-assisted thoracic surgery, VATS, VATS, and we have robotic thoracic surgery, where robotic arms and cameras are used to facilitate operations through very small incisions. These are technically challenging operations, but they seem to be every bit as good in terms of cancer cure as the old-fashioned saw a body in half.
Okay, well, the main thing to do, folks, is not to get in this position in the first place. Cut down on the smoking, but if necessary, it's good to know that someone's there. Hey, now, Natalie.